Today we will guide you about lower back and sacrum pain relief through our Thai Massage Services channel. Sacroiliac (C) joint pain is felt in the low back and buttocks. The pain is caused by damage or injury to the joint between the spine and hip. Sacroiliac pain can mimic other conditions, such as a herniated disc or hip problem. Accurate diagnosis is important to determine the source of pain. Physical therapy, stretching exercises, pain medication, and joint injections are used first to manage the symptoms. Surgery to fuse the joint and stop painful motion may be recommended. What is sacroiliac joint pain? The C joints are located between the iliac bones and the sacrum, connecting the spine to the hips. The two joints provide support and stability, and play a major role in absorbing impact when walking and lifting. On the back, the C joints are located below the waist where two dimples are visible. The sacroiliac joints connect the base of the spine, sacrum, to the hip bones, ilium. Strong ligaments and muscles support the C joints. There is a very small amount of motion in the joint for normal body flexibility. As we age, our bones become arthritic and ligaments stiffen. When the cartilage wears down, the bones may rub together causing pain. The C joint is a synovial joint filled with fluid. This type of joint has free nerve endings that can cause chronic pain if the joint degenerates or does not move properly. Sacroiliac joint pain ranges from mild to severe depending on the extent and cause of injury. Acute C joint pain occurs suddenly and usually heals within several days to weeks. Chronic C joint pain persists for more than 3 months. It may be felt all the time or worsen with certain activities. Other terms for C joint pain include C joint dysfunction, C joint syndrome, C joint strain and C joint inflammation. What are the symptoms? The signs and symptoms of C pain start in the lower back and buttock, and may radiate to the lower hip, groin or upper thigh. While the pain is usually one-sided, it can occur on both sides. Patients may also experience numbness or tingling in the leg or a feeling of weakness in the leg. Symptoms may worsen with sitting, standing, sleeping, walking or climbing stairs. Often the C joint is painful sitting or sleeping on the affected side. Some people have difficulty riding in a car or standing, sitting or walking too long. Pain can be worse with transitional movements, going from sit to stand, standing on one leg or climbing stairs. What are the causes? The C joint can become painful when the ligaments become too loose or too tight. This can occur as the result of a fall, work injury, car accident, pregnancy and childbirth, or hip, spine surgery, laminectomy, lumbar fusion. Sacroiliac joint pain can occur when movement in the pelvis is not the same on both sides. Uneven movement may occur when one leg is longer or weaker than the other, or with arthritis in the hip or knee problems. Autoimmune diseases, such as ankylosing spondyloarthropathy, and biomechanical conditions, such as wearing a walking boot following foot, ankle surgery or non-supportive footwear, can lead to degenerative sacroiliitis. How is a diagnosis made? A medical exam will help determine whether the C joint is the source of your pain. Evaluation includes a medical history and physical exam. Your physician will consider all the information you provided, including any history of injury, location of your pain, and problems standing or sleeping. There are specific tests to determine whether the C joint is the source of pain. You may be asked to stand or move in different positions and point to where you feel pain. Your doctor may manipulate your joints or feel for tenderness over your C joint. Imaging studies, such as X-ray, CT, or MRI, may be ordered to help in the diagnosis and to check for other spine and hip-related problems. A diagnostic C joint injection may be performed to confirm the cause of pain. The C joint is injected with a local anesthetic and corticosteroid medication. The injection is given using X-ray fluoroscopy to ensure accurate needle placement in the C joint. Your pain level is evaluated before and 25-35 minutes after injection, and monitored over the next week. Sacroiliac joint involvement is confirmed if your pain level decreases by more than 70%. If your pain level does not change after the injection, it is unlikely that the C joint is the cause of your low back pain. What treatments are available? Non-surgical treatments, physical therapy, chiropractic manipulation, and stretching exercises help many patients. Some patients may require oral anti-inflammatory medications or topical patches, creams, salves or mechanical bracing. A needle is gently guided into the sacroiliac joint using X-ray fluoroscopy. An anesthetic and corticosteroid mixture, green, is injected into the inflamed joint. Joint injections, steroids can reduce the swelling and inflammation of the nerves. Joint injections are a minimally invasive procedure that involves an injection of a corticosteroid and an analgesic numbing agent into the painful joint. While the results tend to be temporary, if the injections are helpful they can be repeated up to 3 times a year. Nerve ablations, injections into joints or nerves are sometimes called blocks. Successful C-joint injections may indicate that you could benefit from radiofrequency ablation, a procedure that uses an electrical current to destroy the nerve fibers carrying pain signals in the joint. Surgery. If non-surgical treatments and joint injections do not provide pain relief, your physician may recommend minimally invasive C-joint fusion surgery. Through a small incision, the surgeon places titanium, metal, implants and bone graft material to stabilize the joint and promote bone growth. The surgery takes about an hour. The patient may go home the same day or following day. For several weeks after surgery, the patient cannot bear full weight on the operated side and must use crutches for support. Recovery and prevention, a positive attitude, regular activity, and a prompt return to work are all very important elements of recovery. If regular job duties cannot be performed initially, modified, light or restricted duty may be prescribed for a limited time. Prevention is key to avoiding recurrence. Proper lifting techniques, good posture during sitting, standing, moving, and sleeping, regular exercise with stretching or strengthening an ergonomic work area, good nutrition, healthy weight, lean body mass, stress management and relaxation techniques, no smoking. The sacroiliac joint lies next to the bottom of the spine, below the lumbar spine and above the tailbone, coccyx. It connects the sacrum, the triangular bone at the bottom of the spine, with the pelvis, iliac crest. See sacroiliac joint anatomy. The joint typically has the following characteristics: small and very strong, reinforced by strong ligaments that surround it, does not have much motion, transmits all the forces of the upper body to the pelvis, hips, and legs, acts as a shock-absorbing structure. Article continues below. While it is not clear how the pain is caused, it is thought that an alteration in the normal joint motion may be the culprit that causes sacroiliac pain. This source of pain can be caused by either too much movement, hypermobility or instability. The pain is typically felt in the lower back or hip and may radiate into groin area. Too little movement, hypermobility or fixation. The pain is typically felt on one side of the low back or buttocks, and can radiate down the leg. The pain usually remains above the knee, but at times pain can extend to the ankle or foot. The pain is similar to sciatica, or pain that radiates down the sciatic nerve and is caused by a radiculopathy. This condition is generally more common in young and middle-aged women. For decades, the sacroiliac joint was suspected to be a common cause of low back or leg pain, although difficulty in proving it with standard diagnostic tests left many in the medical profession skeptical. Also, over the last 20 to 30 years, the medical profession was focused more on discogenic pain, herniated disc, degenerative disc disease, as a common cause of low back or leg pain. In fact, to this day sacroiliac joint dysfunction remains difficult to diagnose, but anesthetic injection blocks specifically applied to the C joint are considered the gold standard. Typical treatments for sacroiliac joint dysfunction include ice, heat, and rest. Initial treatment recommendations will typically include use of ice or cold packs, applied in 15 to 20-minute intervals as needed to reduce inflammation in the area, along with rest to reduce irritation. Depending on the duration of sharp, intense pain, ice can be continued anywhere between 2 days to 2 weeks. Once the inflammation is less, gradual return to normal activities may be advisable. Application of heat, such as a heat trap or hot bath, may help the healing process, but not during the acute, high-intense pain time frame. Heat therapy application can help provide lower back pain relief through several mechanisms. Heat therapy dilates the blood vessels of the muscles surrounding the lumbar spine. This process increases the flow of oxygen and nutrients to the muscles, helping to heal the damaged tissue. Heat stimulates the sensory receptors in the skin, which means that applying heat to the lower back will decrease transmissions of pain signals to the brain and partially relieve the discomfort. Heat application facilitates stretching the soft tissues around the spine, including muscles, connective tissue, and adhesions. Consequently, with heat therapy, there will be a decrease in stiffness as well as injury, with an increase in flexibility and overall feeling of comfort. Flexibility is very important for a healthy back. There are several other significant benefits of heat therapy that make it so appealing. Compared to most therapies, heat therapy is quite inexpensive, and in many circumstances it's free, such as taking a hot bath. Heat therapy is also easy to do. It can be done at home while relaxing, and portable heat traps also make it an option while at work or in the car. For many people, heat therapy works best when combined with other treatment modalities, such as physical therapy and exercise. Relative to most medical treatments available, heat therapy is appealing to many people because it is a non-invasive and non-pharmaceutical form of lower back pain relief. Medications. First line of treatment often may include pain medications, such as acetaminophen, as well as anti-inflammatory medications, such as ibuprofen or naproxen, to reduce the swelling that is usually contributing to the patient's pain. Chiropractic manipulations. Manual manipulation provided by a chiropractor, osteopathic doctor, or other qualified health practitioner may help. This can be highly effective when the C-joint is fixated or stuck. It may be irritating if the C-joint is hypermobile. This is accomplished by a number of methods including, but not limited to, side posture manipulation, drop technique, blocking techniques, and instrument-guided methods. Your healthcare provider will choose a method they feel is most appropriate for your specific case. Supports or braces. When the C-joint is hypermobile or too loose, an orthotic or brace about the size of a rather wide belt can be wrapped around the waist and pulled snugly to stabilize the area. This can sometimes be very helpful at times when the joint is inflamed or painful. When it calms down, the orthotic can be weaned away. Physical therapy and exercise. Controlled, gradual physical therapy may be helpful to strengthen the muscles around the sacroiliac joint and appropriately increased range of motion. In addition, any type of gentle, low-impact aerobic exercise will help increase the flow of blood to the area, which in turn stimulates a healing response. For severe pain, water therapy may be a reasonable option, as the water provides buoyancy for the body and reduces stress on the painful joint. Sacroiliac joint injections. While the primary reason for sacroiliac joint injections is to determine whether or not the sacroiliac joint is the cause of the patient's pain, it is also useful in providing immediate pain relief. As part of the injection, an anesthetic, such as lidocaine or bupivacaine or novocaine, is typically injected along with an anti-inflammatory medication, such as a corticosteroid, to help reduce inflammation around the joint, which in turn will help alleviate the pain. The immediate pain relief can help the patient start with a physical therapy program and return to normal activity levels. Symptoms of disease. Pain in the sacrum. Sacrum, Latin os sacrum, is a largish triangular-shaped bone at the base of the spine, forms the upper rear portion of the pelvis, like a wedge located between two of the pelvic bones. The upper part of the rump is connected with the last lumbar vertebrae, lower, with the coccyx. Sacral vertebrae, Vertebrae sacrales. Number 5, together with an adult in a single bone, sacrum. Sacrum, the os sacrum, as the form of the wedge, is located under the last lumbar vertebra and participates in the formation of the rear wall of the small pelvis. In bones distinguish between the front and rear surface, two side edges, the base, a large part of that comes up, and the top, the narrow part, the downward. From the base to the top of the sacrum bone is riddled with curved-shaped sacral channel, canalus sacralis. The front surface of the sacrum smooth, concave, facing in the pelvic cavity, and therefore it is called pelvic surface, facies pelvina. It retains traces of a seamed L5 sacral vertebrae in the form of 4 parallel coming transverse lines, lineae transversi. To the outside of them are from each party to the 4 pelvic sacral holes, foramina sacralis pelvina, which posteriorly and medially lead in the cavity of the sacral canal. They pass through the front branches of the sacral spinal nerves and their accompanying vessels. The right and left articulation also rump differently. The violation of the right of the sacroiliac joint offset impedes the circulation of the blood in right leg, causing cramps and pain in the muscles. This is a case of right-wing bias of the pelvic bones. Moreover, that the wrong combination gives the sacrum pain, so is a man while still lose weight, suffering from diarrhea, violation of liver, stomach and intestines. Women often have gynecological diseases. If you move the pelvic bones, left obese patients, easily affected by cold, often suffer from constipation and a violation of the functions of the heart and lungs. Hieralgia, sacrodynia, anat. Os, sacrum plus cricodine. Pain in the small of my back, caused by different pathological processes in the small pelvis and surrounding areas. The lower back pain is not a disease, but a symptom complex that only in rare cases should explain the specific reasons for the loss of binding disc, malignant tumors, visceral, neurological or vascular disorders. The term pain in the small of my back is attributed to, thus, only localization in the field spanning disc surrounding the longitudinal ligaments and intervertebral joints, from which, apparently, comes the pain. The cause of the pain, however, only in rare cases can be explained morphological changes. When the worries rump, back pain can be so severe that about anything else and couldn't think. People often confuse the base of her spine and sacrum. Pain in the coccyx is often taken for sacral problems. In general, sacrum is below the spine, however, distinguish where the coccyx and where the sacrum, as a rule, dentist, chiropractor and associated with medicine people. Which diseases there is pain in the sacrum? The main causes of pain in the sacrum: 1. Pain in the rump is observed more frequently in gynecologic diseases, for example when an external endometriosis, localized in the area of the sacro-uterine ligaments and or behind the cervix. Pain in patients with endometriosis are cyclical in nature and amplified during the MILF. 2. Pain in the sacrum, the increasing during physical activity, marked by a chronic back parametritis, leading to a shrinkage rectal uterine ligaments. 3. Pain in the sacrum can be linked, for example, with anomalies of development of the spine, first of all with the transitional lumbar sacral vertebra. In such cases, the pain in the sacrum usually appears suddenly after the load on the spine, the inclination of the torso to the side, and fell at feet, as well as with awkward movements. 4. Aching pain in the sacrum is often a symptom of bias v lumbar vertebra in anteroposterior direction, spondylolisthesis. Blindness may occur also in pathological processes in the muscles of the buttock area, lesions of the sacroiliac ligaments. 5. At a thrombophlebitis iliac and pelvic veins, the pain may be in the back and rump. 6. Pain in the sacrum may appear when the fetus is in the rear position, or vertex, in which the head of the child presses the sacrum bone bearing the rear part of the pelvis. However, this pain can occur after the other provisions of the fetus or when changing from the rear to the front. The reason may be the emergence in this place heightened tension in the muscles. 7. special and serious problem cause pain arising in the small of my back and lumbosacral joints of there. Almost always, and particularly for women, the pain associated with the existing inflammatory or dysharmonious processes of organs of small pelvis. Despite signs of a far from ideal state of the vertebral column in this area, the pain is most often associated with other causes. The condition of the spine only prepares the point of minimum resistance for the formation of painful syndromes. Men, especially the elderly, often demonstrate sacral pain, which are based on any of the processes of the prostate or colon. 8. Traumatic injuries of the sacrum. Patients who complain of pain in the small of my back are often forced to take the unusual position of the body due to spasm of the sacrococcygeal vertebrates muscles. The pain is usually limited to the lower part of the back and disappears within a few days, if the patient is in a state of rest. 9. The tumor, infectious diseases and metabolic diseases. Metastatic cancer of the mammary gland, lung, prostate, thyroid, kidneys, gastrointestinal tract, multiple myeloma and lymphoma, not Hodgkin's, are a malignant tumor, which are most often affect sacrum. Because of their primary localization may escape the attention or be asymptomatic, such patients at the time of treatment to a doctor may complain of pain in the small of my back. The pain is usually permanent and aching in nature, it is often persists peace. At night the pain may worsen. 10. Infectious lesions of the sacrum is usually the result of intrusion pathogenic microorganisms, staphylococci or coliform bacteria, or the causative agent of tuberculosis, which is often difficult to identify on the basis of clinical data. Patients complain of subacute or chronic pain in the small of my back, which increases with the movements, but does not disappear in a state of rest. 11. In the so-called metabolic diseases of the bones, osteoporosis or osteomalacia, a significant loss of bone substance can occur without any symptoms. Many patients with conditions such, however, complain about the long, dull, but not intense pain in the small of my back. 12. Pain in the sacrum with urological or gynecological diseases. In the pelvic area of rare diseases arise, which cause a pain in the small of my back, while this may show itself gynecological disorders. Less than 1/3 of cases of pathological changes in the pelvic area, which are accompanied by pain due to an inflammatory process. Other possible causes, such as relaxation structures that support the uterus, retroversion of the uterus, varicose expansion of veins of the pelvis and swelling of the appendages of the ovary, require further study. It is necessary to emphasize the importance of mental disorders in the majority of unrecognized cases. 13. Pain at the MILF as such can be felt in the sacral region. It is quite poorly localized, tends to spread to the lower extremities and has the character of a colic. The most important source of chronic pain in the small of my back, irradiate of the organs of the pelvis, are, however, uterosacral ligaments. 14. Endometriosis or uterine cancer of the body or neck can affect these structures, and the incorrect position of the cervix may lead to tension. The pain is felt in the center of the sacrum, below the lumbosacral the joints, but can be more pronounced on one side of the sacrum. In patients with endometriosis, pain occurs prior to the MILF, continues for some time and passes in pain at the MILF. Some researchers believe that the incorrect position of the uterus, the deviation of posteriorly, the omission and the loss, leads to pain in the small of my back, especially after a long stay on feet. The influence of the position of the body in this case, similarly to what is observed in tension uterosacral ligaments uterine fibroids. 15. Chronic prostatitis, confirmed by a violation of the functions of the prostate gland, a burning sensation during urination, increased frequency of urination and a small decrease in sexual potency, may be accompanied by a dull pain in the small of my back. She can prevail on one side and irradiating in one leg, if in the painful process involved seed bottle on the same side. 16. prostate cancer with metastases in the lower part of the spine is one of the most frequent cause of pain in the small of my back or lower back. In this case, the pain may not be accompanied by increased frequency of urination or a burning sensation. Tumor cells may infiltrate the spinal nerves, compression of the spinal cord possible with the defeat of the epidural space. The diagnosis is made on the basis of a study of the rectum, data radiographic techniques and radioisotope scanning of the spine and determination of activity of acid phosphatase, especially fraction phosphatase of the prostate gland. 17. Pain in the lumbosacral spine can be strengthened, for example, with the expansion of Ample's bowel due to the accumulation of fecal masses or the exacerbation of colitis. If you are visiting Manchester and in need of relaxation, there is no better place to go. All this and competitive prices mean that TMS Traditional Thai Massage just has to be your first choice in Manchester. For more useful tips, please subscribe our Thai Massage Services channel on YouTube.